More than 2.5 years after King Charles's cancer diagnosis was first announced, Queen Camilla has finally spoken publicly and personally about what that period was actually like for her. This isn't some manufactured headline, it's a genuinely rare, on-record moment from someone who's been notably private about her husband's health throughout this entire ordeal. So let's go through exactly what she said, what it reveals about those early days before the world knew, and where things actually stand with Charles's treatment right now. If you want more of this kind of grounded, fact-checked royal coverage, consider subscribing. Let's get into it. Here's the context for this interview. Camilla sat down with Dame Laura Lee, the chief executive of Maggie's, a UK cancer charity she's served as president of since 2008, for a short film marking the charity's 30th anniversary. The conversation was filmed at Clarence House and released to the public on August 18th. Maggie's operates 27 cancer support centers across the UK, each built on the grounds of a major NHS hospital. And the organization supports hundreds of thousands of people affected by cancer every year. This wasn't a tabloid interview or a leaked conversation. It was a deliberate, planned appearance tied to a cause Camilla has been personally involved with for nearly 2 decades, which is part of why her comments carry real weight. It's worth understanding a bit more about Maggie's itself, since Camilla's long association with the charity is what made this interview possible in the first place. The organization was founded in 1996 by Maggie Keswick-Jenks, a garden designer and writer who was herself living with cancer, alongside her husband and medical professionals who felt strongly that cancer patients needed more than just clinical treatment. They needed a place to process the emotional and practical realities of a diagnosis alongside people who understood what they were going through. That founding vision, treating the whole person rather than just the disease, is presumably part of why Camilla has stayed so closely tied to the charity for almost 20 years. And it's also likely part of why this particular interview felt like the right venue for her to finally speak about her own experience. A setting built specifically around the idea that cancer's emotional toll deserves as much attention as its physical one. Now, let's get into the actual timeline, because this is where the most personally revealing part of the story lives. On January 31st, 2024, Camilla visited a newly opened Maggie's Centre at the Royal Free Hospital in London. Buckingham Palace didn't publicly announce Charles's cancer diagnosis until February 5th, 5 days later. So Camilla was standing in a room full of cancer patients and their families, fully aware of her own husband's diagnosis, unable to say a single word about it. In the interview, she described that experience directly. She recalled visiting the center just after Charles had been diagnosed and said that nobody could say anything at the time, calling it quite difficult. She went on to describe almost saying something, but recognizing it wasn't the moment, and instead looking around at everyone in the room who was suffering, along with their families, which she said made her realize even more just how important places like Maggie's actually are. She summed up the feeling simply. She was longing to let it out, but obviously couldn't. That's a genuinely human, relatable detail buried inside an otherwise very formal, guarded royal life, standing in a room built specifically to help people talk openly about cancer, while carrying a secret about her own husband's diagnosis that she wasn't permitted to share. It's a small window into just how much personal restraint is required of royal family members even during their most difficult private moments. Restraint that most people watching this video will never have had to exercise in quite the same public-facing way. It's also worth thinking about why that particular gap, 5 days between Camilla knowing and the public finding out, mattered so much operationally, even though it sounds short on paper. Announcing a health diagnosis for a reigning monarch isn't something the palace can simply blurt out the moment doctors confirm it. There's a whole process behind the scenes, confirming the diagnosis with certainty, deciding how much detail to share publicly, coordinating the announcement with the Prime Minister's office, and other government bodies who need advance notice of something this significant, and preparing statements and contingency plans in case the news leaked before the palace was ready to control the message itself. 5 days is actually a remarkably tight turnaround for that kind of institutional machinery to move through, which says something about how seriously the situation was being handled internally, even while, from the outside, it looked like business as usual right up until the announcement itself. Camilla also used the interview to reflect on how Charles has approached his illness since the diagnosis became public. She described him as her poor husband and said that nothing had stopped him, explaining that his attitude throughout has essentially been to accept the diagnosis as simply his reality and find his own way of coping with it. That framing lines up with everything we've covered about Charles's approach to his illness over the past 2 years, an unusually public, work-focused response where he's continued high-profile duties, state visits, and ceremonial obligations throughout treatment, rather than stepping back from public life the way many people facing a serious diagnosis understandably would. Let's talk about where the treatment itself actually stands right now, because Camilla's comments dovetail with information the palace has released more formally. Charles was diagnosed after undergoing a procedure for a separate, benign enlarged prostate condition in January 2024, with the cancer discovered incidentally during that process. He briefly paused public engagements before returning to duties in April 2024. In December 2025, in a taped message for Channel 4's Stand Up to Cancer, Charles announced that his treatment schedule would be reduced going into 2026, crediting early diagnosis, effective intervention, and adherence to his doctor's orders. He described it as both a personal blessing and a testament to how far cancer care has advanced. He's continued receiving treatment since then, and Buckingham Palace has consistently described his health as moving in what they call a positive direction. Though the palace has never used the word remission, and Charles has never disclosed the specific type of cancer he has. It's worth tracing this timeline in a bit more detail because the public updates have actually come in a fairly steady drip over the past 2.5 years, even without a single comprehensive medical disclosure. Shortly after his initial diagnosis, Camilla told reporters in Aberdeen that he was fine and looking forward to getting back to work. Later that year, during a visit to the Army Flying Museum, Charles himself described losing his sense of taste as a side effect of treatment, declining to say whether doctors expected it to be temporary or permanent. He was also briefly hospitalized in March of that year due to treatment side effects, an episode a palace aide later described as the most minor bump in the road before he resumed his full schedule within days. Around that same period, Charles described the diagnosis itself, in his own words, as daunting and at times frightening. One of his more candid public reflections on the emotional weight of the experience rather than just the practical logistics of managing it. By the following year, royal aides were describing him as effectively managing his condition while trying to live as close to a normal life as medical science would allow, with one senior aide noting that advances in cancer treatment meant there was genuinely little visible difference in how Charles carried himself day to day, provided he followed his doctor's guidance. That aide also made a point of framing his approach as fundamentally about duty, describing him as someone who simply gets on with things because that's what he's driven by. Taken together, this string of small incremental updates, a taste side effect here, a brief hospitalization there, a reduced treatment schedule announced a year later, paints a far more detailed picture of his health journey than any single dramatic disclosure could have, even without ever naming the specific cancer involved. There's also a genuinely meaningful public health impact tied to all of this that's worth mentioning. According to Laura Lee, the number of men visiting Maggie's centers has risen 12% in the years since Charles first went public with his diagnosis. That's a real, measurable outcome tied directly to a royal family member choosing to be public about a health struggle that's traditionally been kept entirely private within the institution. Charles himself has leaned into that impact deliberately, using his own experience to encourage broader public health messaging, including pointing out in his December message that at least 9 million people in the UK aren't currently up to date on their cancer screenings, and urging people to get checked. That 12% figure is worth sitting with for a second, because it represents a genuinely significant real-world behavior change tied to essentially one decision: choosing to be public rather than private about a diagnosis that royal tradition would ordinarily keep entirely hidden. Men, as a group, are notoriously reluctant to seek medical attention or talk openly about health concerns, and public health campaigns have struggled for years to shift that pattern through conventional messaging. A high-profile, widely respected public figure going through the same experience in full view and talking about it candidly rather than disappearing from public life appears to have done more to move that needle than a lot of dedicated awareness campaigns manage on their own. It's arguably one of the more concretely positive, measurable legacies of this entire difficult chapter, regardless of how private the specific medical details have remained. Quick break. If you're finding this kind of grounded, fact-checked royal health coverage useful, drop a comment letting me know if you'd like a dedicated video breaking down the full timeline of Charles's diagnosis and treatment from the very beginning. And I'll put that together next. It's worth talking about the toll this has taken on Camilla herself, too, because that's been a quieter, but equally real part of this story. Royal watchers and insiders have described the past 2 years as a genuine strain on the couple. One friend, speaking to the Daily Mail's royal editor, described it as a worrying, uncertain time for them as a couple, and noted that towards the end of 2024, Camilla herself became quite unwell, largely attributed to exhaustion from constant travel, and having to step up in Charles's place during periods when his own health limited what he could do. She was in fact forced to cancel a run of engagements in late 2024 after being diagnosed with pneumonia, a period during which her son, Thomas Parker Bowles, publicly addressed and dismissed circulating rumors about the seriousness of her condition. Camilla has also been fairly open, in a lighter, more good-humored way, about the ongoing challenge of trying to get Charles to actually slow down. During a state visit to Italy, she told reporters that watching him recover has come with an unexpected problem. That once someone starts feeling better after being unwell, they tend to want to do more and more, which she described, with clear affection, as the real issue. She's made similar comments on other occasions too, noting that the real difficulty has never been his health exactly, but stopping him from taking on too much despite it. That pattern, a king who insists on pushing forward no matter what, paired with a queen who's constantly trying to rein in that instinct out of concern for his well-being, has become one of the more consistent human threads running through their entire marriage during this health crisis. There have even been reports of genuine friction between them over exactly this issue. According to sources who spoke with the Daily Mail's royal editor, the couple has been known to disagree, sometimes quite strongly, on how much Charles should be doing given his condition, with one friend describing it as the main point of tension between them over the past year specifically, because Camilla can't seem to persuade him to properly take time out. The same source noted that beyond the first couple of months following his diagnosis, Charles has essentially worked every single day since, a pace that would be demanding for anyone, let alone someone managing ongoing cancer treatment. That friend also made an observation that captures something real about how this institution handles illness generally, noting that the royal family, as a rule, simply doesn't do sickness well, and suggesting that's part of what made the whole experience so difficult for Camilla specifically. Trying to support a husband who was determined to treat a serious diagnosis as something to simply push through rather than something requiring any real accommodation. There's also an interesting parallel worth drawing here to Kate's own cancer journey, since the two situations unfolded almost simultaneously. Kate announced her diagnosis in March 2024, just weeks after Charles's own announcement, and underwent roughly 6 months of preventive chemotherapy before being reported to be in remission about a year later. In June of this year, Charles and Kate made their first joint cancer-focused public appearance together at a Cancer Research UK reception marking that charity's 125th anniversary. A moment that brought together two family members who'd each gone through a serious health scare within weeks of one another. Kate has also spoken publicly about her own recovery, and the combined effect of multiple senior royals being open about their cancer experiences has reportedly amplified public health messaging in a way that reaches audiences that more traditional campaigns often struggle to connect with. That's really the bigger picture Camilla's comments fit into. A family that's been notably guarded about the exact clinical details of these diagnoses. No named cancer type for Charles. Limited specifics from Kate as well, but has simultaneously been unusually open about the emotional and practical realities of living through it. Camilla's interview adds the caregiver's perspective to that picture, someone watching a spouse push through treatment while trying to maintain a semblance of normal life and duty, which complements both Charles's own patient narrative and Kate's recovery story in a way that gives the public a genuinely fuller picture of what this stretch has actually looked like behind palace walls. There's something worth noting about how rare this kind of triangulated openness actually is for an institution like the British monarchy. Historically, royal illness has been handled with extreme discretion, sometimes to the point of near total secrecy, even from close family members, let alone the public. King George VI's own lung cancer diagnosis in the early 1950s was kept from him entirely by his doctors and family, an approach that would be almost unthinkable today given how openly Charles, Camilla, and Kate have all discussed their respective experiences, even with the specific diagnoses withheld. That shift reflects a broader, generational change in how the monarchy relates to the public. Less about maintaining an image of untouchable invincibility, and more about finding a version of openness that still protects genuine medical privacy while allowing the human reality of illness to be visible and, apparently, genuinely useful to other people going through similar things. So, what does this actually tell us going into the rest of 2026? Charles remains an active, working monarch with a treatment schedule that's been meaningfully reduced due to positive progress, even though the exact clinical picture remains private. Camilla, for her part, has clearly weathered a genuinely difficult, high-pressure 2 years alongside him, managing her own health scare in the process while continuing to show up publicly in support of both her husband and causes like Maggie's that speak directly to what the family has personally experienced. And the broader impact of the family's openness, even with its limits, appears to be having a real, measurable effect on how comfortable ordinary people feel, seeking their own cancer screenings and support. That's the real story behind this interview. Not a bombshell in the traditional dramatic sense, but a genuinely moving human account of what it's actually been like inside one of the most scrutinized marriages in the world during one of its hardest chapters. It's a reminder that even families with every institutional resource imaginable at their disposal still experience illness the same way most families do, with fear, with restraint, with someone trying to hold things together while quietly worrying about the person they love. If there's a further health update, a new development in Charles's treatment, or anything else worth covering here, I'll be on it, so make sure you're subscribed for that. And if you want the full breakdown of Charles's health journey from the original diagnosis through to today, I covered that in detail in another video. You can check it out by clicking right here.